Hello, my name is Dr. Shane Watt. I'm the Director and Treating Physician at Mountain West Chiropractic and Neurobiologic Health Center. We're located in South Jordan, Utah. Today, we're going to talk about auto accidents and how they apply to people getting injured, especially in the state of Utah. And we're going to try to make it as easy as possible. So let's get into this. First of all, there's many common reasons for accidents. We have the roll in where we don't stop at the red light and we kind of just roll in. That causes quite a few accidents, about 7%. Falling asleep causes 7% also. But 21% of fatal crashes are because of people falling asleep. Loss of control. Here's a funny stat. 50% of all drivers feel like they're in the top 2% of drivers. Well, we know that's not all true. Here's more of the top reasons. Driving into the blind. That's when you are pulling out, you can't see what you're looking at, okay? And you just either go too fast or you're just not clear and you go anyway. Rear end collisions, that's what we're going to talk a lot about today, as well as distracted lane changes. This is people texting. This is people on their phones, sightseeing, all these kind of things, daydreaming, and we got that from author Steve Kessner. We appreciate that. Here's the truth about auto accidents. There's about 6 million Americans who are in auto accidents every year. About half of those people get injured in the accident. About half of those recover without any complicating factors. The other half have some complicating factors, okay? These half have continued problems. 300,000 of those people become disabled. That's a scary statistic. 300,000 people a year become disabled because of auto accidents. Some more information. Minor neck injuries are about 60% of all permanent impairments. 50% of all chronic neck pain is because of these auto accidents. And here is the kicker. Most of these auto accidents are what would be considered low impact, minimal damage to the car. We're going to talk a little bit more about that. Here's another crazy statistic. 9%, basically 1 in 10 Americans suffering with neck pain, it is a result of an old auto injury. That's why we're talking about this today. A lot of people out there suffering. Here's something people don't really understand or don't know. Multiple studies show that being injured with only a 5-mile-an-hour collision, so that's not very fast, but it does this. It puts 7 to 10 G's on the neck and it causes whiplash. And yet most of those injuries, there is no visible damage on the car. Here's the thing. When I was a little kid, okay, I'm 47. When I was a little kid, cars were made really sturdy. Okay, they were made out of steel, and the bumpers were steel, and all those kinds of things. To damage those things was really hard. Nowadays, everything's made out of fiberglass and it's all engineered and it's for our protection. The problem is the cars are made to collapse. So the big thing is the individuals in the car take a lot of the brunt of the injury. Okay? They just make cars differently. And we'll talk a little bit more about that, but not much. So symptoms of whiplash. You have your common neck pain, headache, mid-back pain, low back pain. Those are really common things. But there's other things that come along that I don't think most people are aware of. Especially when you get that nauseated feeling. Right after the accident, people get that nauseous feeling, and they think it's because they're nervous or scared about what's going on. It's actually a neurological thing that is happening to the body. You get anxiety, arm pain, numbness, blurred vision is fairly common. You forgetfulness because of the injury. Difficulty sleeping, that's a really common one right after the accident. People think, well, because I'm worried about the injury and stuff like that. No, it messes things up, okay? And also impaired thinking. You're just not able to think as clear. So there's a lot of symptoms that people don't really relate to an auto accident that are from the auto accident. Here are some other things that increase the risks of problems from a car accident. Rear end collision. If it's a rear end collision, it throws you up into a higher category of problems. Okay? Dizziness, neurological symptoms, limited range of motion. So as soon as the accident's occurred, within minutes you're turning your neck like this and you're not able to turn. We know that that's a problem. Okay? Ligament instability. And here's another thing. People also feel like if they had issues before an accident, they can't rightfully go and get help. But that's not true. If you have arthritis, which is fairly common, especially in people 50 and older, and you already have issues, if you have an accident, it's going to make those issues worse. Okay? It doesn't affect your case, but it's highly important that you actually do go in and get care. Here's some other things that are really important. Body position. If you are looking forward, you're rear-ended, this is a different injury. If I'm at a stoplight and I'm talking to the passenger next to me and I'm like this and I get rear-ended, that is a different injury. If it's hit from the side and it's this, all those things play a factor in the type of injury and how you respond to care and how quick you respond to care. Head position. If it's in the right position with the head, your head restraint behind your head, a lot of times with whiplash you actually go up and over, and that's what causes a lot of the pain and problems as well. So you got to have your head restraint in the right position. Leg position right here. Never, never, never have your legs up. I know people like to. My kids like to. I understand that completely. The problem is if you are in an accident and you're like this, those airbags come out, your legs can be decapitated. Those airbags come out at a very high rate of speed. Also, just regular body position. If you're slunched over, you're leaning over, all those kind of things play a factor. So make sure you let your doctor know what your position was. Seatbelts. Here's the truth, the hard truth facts about seatbelts. Seatbelts actually cause more injuries in accidents. However, seatbelts save lives. So yes, you should be wearing your seatbelt. But years ago, there weren't as many whiplash injuries because people would come forward and they would smash their face into the steering wheel and things of that nature. Now the seatbelt's here, so now they get more of the whip. And that's what the whiplash is from. It's more of the whip. You also can have injuries like this picture from the seatbelt. Also, airbags. Airbags can come up. If you don't have a seatbelt on, those can blow up and cause major damage. And once again, where the head restraint is. Here's another thing that I think is a myth that people always talk about. Everyone always talks about the person that was drunk that caused the accident never dies. They're not injured because they're so relaxed because they're intoxicated. That is an absolute 100% non-truth. If you see an accident coming, you brace with everything you have. You want to reduce the amount of throwback that can happen. Now, I use this example. Football. If a person's running with a ball and they see a tackler come to get him, it's better for them to go into it, duck a shoulder, and tighten up. In an auto accident, it is the exact same. Because that kid that's running with football, if he sees someone coming, he doesn't just relax and get hit and get launched all over the place, right? So please, please, if you see it coming, you brace and hold on for dear life, okay? Here's the other thing. So if you're aware of the accident, that's vitally important. What is your body type? All right? Are you like this guy that's totally ripped, really good mass? Are you a female, an elderly person? All these things come to play. What your body mass is like, what your strength is like, how feeble you are. So an 85-year-old, really nice, petite, older lady driving around and getting in an accident, she's going to have a lot more damage done to her. So all these things come into play. So you have to be aware of that. Here's some additional risks, especially here in Utah. We have crazy weather changes, right? You know, I always tell people I love Utah, and the reason is because you can go skiing, and later on that day you can come down and play golf, right? We have different weather. We have the mountains. But one of the biggest things is we have snow, and then in 2 days that snow can be gone because all of a sudden it goes from 20 degrees up to 50 degrees, right? Well, what happens? Well, that water melts, and then throughout the night it drops back down in temperature, and now we have more ice. So there's a lot of complicating factors. We have major rainstorms, not as much as we would like, but when we have some big rainstorms, we get those. We have the snow, we have fog, all these things come into play, and they inhibit good driving. It's just the nature of the beast, right? So it does play a difference. So what do you do when you're in an auto accident? Here's the quick and easy of it all. You do want to call the police. It limits a lot of problems down the road. It limits people that are out of control because, let's just be honest, some people are just not very nice. Whether it's a person that gets hit or the person that hits, it's just crazy. Some people are just not very nice. Okay? So, call the police. They can document. Also, get out of traffic. You don't just you don't want to be in a main thoroughfare of traffic and just sit there waiting for the police. Now, there's major injuries, yes, that is the case. But if you both can pull over, you want to get out of harm's way. Also, you want to document. You want to get out and take pictures. You want to write things down. You want to make sure and get the information of the people who were in the accident. Just had a patient come in the other day, and she was told that person had insurance and all these other things. We'll come to find out none of that was true. So make sure the cops get the information they're supposed to get as well. Reality is, though, if you are injured and it's a bad injury, go to the emergency room. You want to go there. It's good for documentation, but it is also important to make sure that there's no fractures. If you don't feel anything, if you don't feel too bad, then you don't need to go to the emergency room. But if you got broken bones, all those kind of things, you want to get there, right? Emergency rooms are great for crisis care, broken bones, breathing issues, cuts, you know, if you need stitches, all those things are really important. But you want to be aware of a couple of things. If you can avoid going in an ambulance, then don't. Now, if you need to go, go. Your safety is the most important thing. All the other stuff can be taken care of later. But if you don't need to go in an ambulance, have somebody take you to the emergency room. Why am I saying that? Because an ambulance ride can be between $1,500 and $2,000, and it drastically affects the dollars that are there for you to be taken care of otherwise. Okay? Just to walk in an emergency room, you're looking at a $500 bill. So if you don't feel like you need to go, you know, that's your call. But if you are injured, you want to get checked out. You want to make sure. But here's the thing. Emergency rooms are not there for your care. They're there to make sure everything's okay according to them, but they're not there to treat you down the road. Now, that's why you call us, because that's what we do. We'll get into this a little bit more, but here's my phone number, 801-495-4444, for those who have been in auto accidents. We help those patients and help them get back as quick as possible. But let's go into this a little bit more. Okay, medical doctors. If you go to your medical doctor / the emergency room after an auto accident, here's the reality. They don't deal in that. They really don't. That's not their niche. That's not what they are trying to do. Yes, they're more than happy to take a look at you and make sure that what they think is okay. But the problem is the only thing they do for you is pain pills and muscle relaxants. Okay, pain pills hide the pain. Muscle relaxants, in my opinion, are not a good thing because everything gets relaxed. And the reason why you're hurting and the reason why things are in spasm is because your body's trying to protect itself. So I'm not a big fan of those. But if you need to take some medication right after an accident because you're hurting pretty bad, take it. But we want to get you off that as quick as possible. Medical doctors don't deal in the structural world. That's not what they do. Okay? Also, one of the leading causes of addiction, we've hearing it all over the place now, opioid addiction. One of the main reasons for opioid addiction is because someone was in an accident. Auto accidents are huge in that realm, and then they get addicted to the pain pills. Let's try to avoid that. All right. They will take x-rays. Sometimes they will, sometimes they won't. But you really want to be careful when you go in, and it's for more just to get checked out and make sure, it's for major injuries. Now, another thing, because medical doctors don't like to deal with auto accidents, what they do is, because physical therapists are in their network, they're in their system, they refer a lot to physical therapists. Now, physical therapists can do a great job. They do. They have a great industry that they work in. In my opinion, auto accidents are not their best industry. Rehabilitation, after surgeries, things to get people back to work because of things like that is their specialty. But that acute care is not, in my opinion, not their best thing. You can stretch, you can exercise, all those things are great, but if you're injured, it's only going to keep that injury going. And so you want to work that structure, and that's the biggest thing. When you're in an auto accident, it is absolutely proven that structural damages occur. Neither one of these type of healthcare providers work in the structural realm. So, common injuries in car crashes. We already talked about the whiplash symptoms and things of that nature, but structural injuries to the spine. Things get messed up. Okay, that whiplash changes. Yes, there's muscle involvement. There is. Okay, there has to be. But there's structural involvement, ligaments, tendons, okay, sprain strain injuries of the spine, acute tearing, micro tearing of the muscles, and inflammation. All this leads to inflammation. That's why we got to get the structure working properly so that inflammation can be reduced, and the muscle spasms as well. Also, neurological issues. That's something that the standard medical doctor and physical therapists don't really deal with after auto accidents. There can be concussions. Just getting the brain cleared after getting adjusted can help with those concussions. Now, if there's other things more severe, yes, you want to be co-treating that. Dizziness, neurological damage, disc issues, all those things can happen. And that's where I feel chiropractors are best suited. And that's why I've done special training and additional training for auto accidents. Here's a common thing. My accident was just a small little fender bender. Do I really need anything? Do I really need to be treated? So in that kind of case, do you need to go to the ER? No. Do you need to go really to your medical doctor? No. Why go to the chiropractor? So here's the reason. Why come to us? Many injuries don't show up until weeks and months later. When I first got into practice 20 years ago, one of the classic things that I remember is a patient came in and they were suffering with really bad headaches, and they had no idea why. So we're going through the history, and they're like, yeah, they've been going on for like 2 months. They just keep getting worse and worse and worse, and that's why I'm here. I need your help. So I'm like, well, what changed? What happened? What was different? And they couldn't think of anything. And all of a sudden the wife's like, you know what? He was in a car accident about 3 months ago. He never related that to the headaches because immediately after the accident, he didn't feel like he'd been injured. So it's always good. You know what? It's great to go in and see us right after an accident. If it's not bad, then you might only need to be seen 4, 5, 6, 7 times to just get it cleared out and make sure you're good and you're not going to have residual problems. So yes, you do want to come in and get checked out. Many injuries can be present even if little damage is done to the car. Okay, we talked about that earlier, but it's very important. A lot of people think, oh, there's nothing done to the car, or people, the insurance company will ask you about that and try to dissuade you not to do anything, and we'll talk about that in just a little bit. Here's a fact. People can be killed at 10-mile-an-hour impact. So if people can get killed, then you can be injured. I had another incident, another patient of mine several years ago. She was in the car with her husband. It was a rollover accident. He eventually died because of that accident. And honestly, she came in, we saw her probably 7 to 10 times, and she was done, and she was good. So accidents are different for everybody. It depends on where you're at, how the accident occurred, where you are in the car. I mean, there's so many different factors. But it is best to come in and see us so that we can get you properly taken care of. And you know what? It might be just a couple visits. Sometimes it takes a lot longer because of the severity of the accidents. Also, it's better to get it taken care of now than later, because now you're covered by your insurance. We're going to talk a little bit about the insurance, but right after the accident, you're 100% covered. Months later, it can get kind of scary because it's hard to prove that those things are a result of the accident if there's no paper trail. So why should you come in and see me? Why should you come in? Why should I've heard different scenarios about chiropractors, or there's different prejudices out there and all that kind of stuff. Here's the reality. What we do in the office is get patients well. And we work really hard at staying up to date, doing the things that we need to do to get patients quicker, faster, better, all those things. Okay? We want to get you as well as quick as possible. In auto accidents, though, you want to make sure that there's no residuals. So at the end of care, we might see you 3 or 4 times. If it's a pretty good case, we might see you 3 or 4 times in a 2-month period at the end of care, just to make sure everything's gone. You want to make sure everything's gone. You want to feel better faster. So I do chiropractic. We have multiple different techniques that we use. We have massage therapists in the office. We have some spinal rehab. So all those things are very important. We bill your insurance. We deal with if there's things that are needed because of the accident, we can refer you to different places. The longer you wait, the harder it is to get you better. So you want to get in as quick as possible. You can have a small accident. If you would have gone in right after the accident, it might have been 5 to 7 visits. But because you wait a month, all of a sudden now that puts it into 12 to 15 visits. Why? Because your body is adapting. Inflammation is creating scar tissue. Things are not functioning right, so there's spasm and damage that's occurring. You want to get in as quick as possible. You want to avoid chronic problems later on in life. I talked about the numbers. 9% of all of anyone that has neck pain is because of an old injury. All right, it happens. Also, I think I already said this, because you're covered 100% with your auto accident insurance. So let's go over this real quick, because people are always confused, and I like to explain this. Utah is what is called a no-fault state, and they have what is called PIP. PIP is Personal Injury Protection. That's the dollars that are used when you're in an accident to help you get feeling better at the facilities you go to and the doctors you go to. It is covered at 100%. So if you come into my office and there's PIP, you are covered 100%. Now, what do I mean by if there's PIP? If you haven't already used it. The state minimums, we'll talk about that later, and we'll go into that. But everyone that has insurance has PIP, okay? You need to know, we bill your insurance. You don't have to deal with that. You need to know what your PIP amount is. Will your insurance go up? This is what people always wonder. So here's why they wonder that. If you're the person that gets hit, so you're rear-ended, somebody hits you from behind, you come into my office, we actually, by law, have to bill your insurance. That's what it's meant by Utah being a no-fault state. Everyone always freaks out, why are you billing my insurance? I don't want my insurance to go up. It wasn't my fault. All those things. Don't worry about it. That's the law. Your insurance then deals with their insurance and gets it. No, it is illegal for an insurance company to raise your insurance because you go in and seek health care. Now, if you're the cause of the accident, your insurance may go up because you caused the accident, not because you came into my office to get help. I hope that's clear. Now, also, do you need to have an attorney involved? Our goal is not to have every person that comes into every person that comes in because of an accident have to get an attorney, but sometimes they are warranted. Okay, I have several different ones that we work with. We try to work with ones that are most ethical, legit, and the ones that really are caring about the person. Okay, you're not just a number. So we can work with that. And before you decide who you use, we can give you several different ones, and you can choose, or you can interview them. Okay, that's not a bad thing to do. So this is the PIP tip. Okay, raise it. What do I mean by that? So the state minimums is $3,000 PIP. Now, I said earlier, if you come into my office and there's PIP left, then we can bill it. This is what I mean by that. If you're in an auto accident, You get taken to an emergency room by an ambulance. You're in the emergency room. They take an x-ray. They think you have a concussion, so they do a CAT scan. Guess what? That $3,000 PIP is used up. Here's the scary thing. Hospitals are now getting so greedy that they are trying to bill everything they possibly can on an auto accident. Why? Because they get paid good. And it's easy money, if you want to say. So if you go into a hospital, they are trying to bill things as much as they can, for x-rays to CT scans. A CT scan's $1,000. Just walking into an emergency room is a $500 bill. So if you only have $3,000 and you went to an emergency room, that $3,000 could be gone. Now, it's not always gone, but it very well could be, depending on what they did. And from that point on, anything that you need, you have to get an attorney involved to get your care covered. Here's the thing. If you want to raise your $3,000 PIP to $10,000, it literally costs $1 a month. It's $6 to raise it. When I called my agent and said, hey, if I want to raise it from here to here, what is it? I believe it was $6.38 for 6 months, so $1 a month. If you want to raise it to $25, it goes to $2 a month. I believe it was $13 to raise it to $25. I would suggest that. And if you can raise it for a little bit more, do it. It is the absolute 100% cheapest insurance that you can possibly have. Here's the scary thing. You're in a severe accident. You have to get life flighted. A life flight bill is a minimum of $7,500. Just for them to leave the hospital pad and fly, even if it's 2 blocks away, and pick you up and take you back to the hospital, that's a $7,500 bill. If you're farther away than that, it can be more. Just make it easier on yourself. Talk to your agent and raise it. Insurance companies don't like you to do that because that means they're on the hook more. But guess what? It's the best thing that you can do, and it's the cheapest part of any insurance that you can have. So that's my PIP tip. Okay, so here's the hard, cold facts. Your agent works for you. He should be nice to you. He should care about you. He should have your best interest in mind. Insurance companies are a business. Their goal is to make money. Their goal is to make their insurance company as profitable as possible for their shareholders. That's what when you're a publicly traded company, that is your mandate. So what do they try to do? They try not to pay bills. Okay? So remember, they are a business. Your agents work for you, but they still work for them. But your agents can tell you the truth about your policy, but insurance companies are the one that dictates that truth. Okay? And what I mean by that is, if you're in an auto accident, you have up to like 2 years to use your to use your benefit. But let's be honest, if you don't go to my office until after a year after an accident, there is no way that I can legitimately say that that's a 100% caused by an accident. If I were to go into a court of law, there's no way I can do that. So you're not going to be able to get it taken care of. That's why you come in quickly, right? Okay, adjusters. Let's be real about adjusters. I personally call the adjuster every time. And the reason is because I want to build a good rapport with them. However, most of these adjusters have only a high school education. They get told what the insurance companies tell them. They go to seminars on how to cut claims. That is kind of what their job is. So your adjuster, they're not necessarily in your corner. So you've got to be very careful. Don't sign anything. Because an adjuster's job, first and foremost, is to get your case closed as quick as possible. So they're going to say, oh, you're not hurt that bad? Here, well, let me send you out the information. Just sign it, and then we'll, or hey, we'll give you $500 or something. I mean, I've heard all kinds of different crazy things. Don't do it. Don't do it. It's not worth you having to then pay for care later on because of it. Be careful in your communication. And what I mean by that is your adjuster calls up and says, hey, how are you doing? And you're like, oh, I'm doing good, thanks. How are you? What do? They document. Patient stated they were doing good. Okay? And it's just a common answer that is given. So you have to be very careful. If you ever feel uncomfortable, you just say, you know what, I need you to just talk to Dr. Watt about this. I don't know. Because they're always going to call you. Well, how many visits more do you have? How many of this? And you just say, you know what, I'm not the doctor. You need to talk to the doctor. But that's what they do. They try to get you to stop care as fast as possible and limit what you do at care. So you just want to be careful. I'm not saying they're bad people. That's just the job they've been given. And most of them, unfortunately, don't really last a long time in the adjuster world. It's a high turnover job, and it's very stressful. So always be nice to them, but that's just what their job is. So, once again, my name is Dr. Shane Watt. My office is located in South Jordan, here in Utah. Phone number is 801-495-4444. You can always look at my website, which is watthealth.com. We do a lot of things in our office. We do a lot of auto accidents, but I also do some functional medicine. I do regular chiropractic. We do natural thyroid care, peripheral neuropathy. We do a lot of different things in our office. But because of that, I've learned a lot, and that vast knowledge helps me take care of patients as a whole. So appreciate you listening to this video. If you have somebody that needs to see this, please share it with them. Thank you very much. Have a great day.